Hello everyone, welcome back to Dr. Gilbert's channel. Today we're diving deep into a topic that might make some people squirm, but trust me, it's crucial to understanding your body's signals. We're talking about foamy urine. Now before you click away thinking, ew, gross, let me assure you, this is a judgment-free zone. We're all about open, honest conversations about health here, and sometimes those conversations involve bodily fluids. But on a serious note, changes in your urine can be early warning signs of underlying health conditions, and foamy urine is no exception. So whether you've noticed this yourself or are just curious about what your pee might be trying to tell you, stick around. We're breaking down the causes, remedies, and when it's time to pick up the phone and call your doctor. Let's talk protein, the building block of life, right? We all need it, but when it comes to your pee, too much of a good thing can be a red flag. You see, normally, your kidneys act like expert filters, keeping essential proteins in your bloodstream while letting waste products pass out in your urine. But sometimes, those filters don't work as well as they should. When this happens, protein can leak into your urine, a condition called proteinuria. Now, before you panic, a little bit of protein in your urine now and then might be totally normal, especially after intense exercise or a high-protein meal. But persistent foamy urine, especially if it looks almost soapy, could be a sign of kidney issues. Your kidneys are incredible organs, working tirelessly to remove waste and regulate fluids in your body. So if they're sending out an SOS signal in the form of foamy urine, it's crucial to listen. Don't try to diagnose yourself at home. If you notice persistent foamy urine, make an appointment with your doctor. They can run simple urine tests to check for protein and determine the underlying cause. Early detection is key when it comes to kidney health, so don't brush off this symptom. Taking care of your kidneys means taking care of your overall health. Remember, knowledge is power, and understanding your body's signals empowers you to make informed decisions about your health. We all know staying hydrated is essential, but did you know that dehydration can actually change the appearance of your urine? Yep, you heard that right. When you're dehydrated, your body is low on fluids, and your urine becomes more concentrated. Think of it like this. Imagine adding a teaspoon of sugar to a small glass of water versus a large pitcher. The small glass will taste much sweeter because the sugar is more concentrated. The same principle applies to your urine. When you're dehydrated, the waste products in your urine become more concentrated, giving it a darker color and, you guessed it, a foamy appearance. Now, occasional foamy urine due to dehydration isn't usually a cause for concern. Simply up your fluid intake, especially water, and see if the foaminess subsides. But here's the catch. If you're constantly battling foamy urine, even when you're drinking plenty of fluids, it's time to investigate further. Dehydration can put a strain on your kidneys and potentially lead to other health issues. So listen to your body. If you're constantly thirsty, have dry mouth, or notice your urine is consistently dark and foamy, those are telltale signs that you need to increase your fluid intake. Remember, staying hydrated isn't just about quenching your thirst. It's about keeping your entire body functioning at its best. Ever been in a rush to the bathroom, barely making it in time? We've all been there. But did you know that the force of your stream, especially when you've really got to go, can actually cause your urine to foam up? Think about it. When water comes out of a faucet with high pressure, it creates bubbles and foam. The same principle applies to your pee. When you urinate with force, the stream hits the toilet bowl with more pressure, creating those telltale signs, creating those telltale bubbles. Now, in most cases, foamy urine due to rapid urination is completely harmless and nothing to worry about. It's simply a matter of physics. However, if you notice other symptoms alongside the foamy urine, like pain or burning during urination, increased frequency, or a change in the smell of your urine, it's essential to see your doctor. These additional symptoms could indicate an underlying urinary tract infection or other issues that require medical attention. Remember, your body is constantly communicating with you, and even seemingly insignificant changes like foamy urine can be a sign to pay attention. So the next time you're racing to the bathroom and notice a little extra foam in the bowl, don't immediately jump to conclusions, but do stay vigilant and be mindful of any other changes in your body. Let's talk about UTIs. Those pesky urinary tract infections that can turn a normal day into an uncomfortable ordeal. UTIs occur when bacteria, usually from the rectal area, enter the urethra and travel up to the bladder. Now ladies, I hate to break it to you, but your anatomy makes you more susceptible to UTIs than men. But fellas, don't get too comfortable. UTIs can happen to anyone. One of the telltale signs of a UTI is, you guessed it, foamy urine. But this time, the foam isn't caused by dehydration or rapid urination. It's a result of the infection itself. The bacteria responsible for UTIs can irritate the lining of your urinary tract, leading to inflammation and increased mucus production. This excess mucus can mix with your urine, creating a foamy appearance. Now, foamy urine alone doesn't necessarily mean you have a UTI. However, if you notice other symptoms like pain or burning during urination, a persistent urge to pee, even when your bladder is empty, cloudy or foul-smelling urine, or even blood in your urine, it's crucial to see your doctor right away. UTIs are easily treatable with antibiotics, but if left untreated, they can lead to more serious complications like kidney infections. So don't ignore those early warning signs. Listen to your body and seek medical attention if you suspect a UTI. Now, let's address a more serious potential cause of foamy urine, diabetes. Diabetes is a chronic condition that affects how your body regulates blood sugar. When your blood sugar is consistently high, it can damage blood vessels throughout your body, including those in your kidneys. Remember, those amazing filters in your kidneys that we talked about earlier? Well, when those filters are damaged, they can't do their job effectively, allowing protein to leak into your urine, leading to foamy urine. Now, it's important to note that foamy urine is not a definitive sign of diabetes. However, if you have other risk factors for diabetes, like a family history of the disease, obesity, or a sedentary lifestyle, and you notice persistent foamy urine, it's essential to talk to your doctor. They can perform a simple blood test to check your blood sugar levels and rule out diabetes or start you on a treatment plan if necessary. Early detection and management of diabetes are crucial for preventing complications like kidney disease, nerve damage, and vision problems. So don't ignore those potential warning signs. Take charge of your health and get tested if you have any concerns. Finally, let's talk about medications. Believe it or not, certain medications can actually cause your urine to foam up as a side effect. Now, don't panic and immediately flush your meds down the toilet. Most of the time, this side effect is harmless and doesn't indicate any underlying health problems. Some common culprits include certain antibiotics, pain relievers, and even some medications used to treat rheumatoid arthritis. These medications can sometimes interfere with the normal reabsorption of protein in your kidneys, leading to temporary proteinuria, and you guessed it, foamy urine. If you suspect your medication is causing foamy urine, don't stop taking it without first consulting your doctor. They can help you determine if the medication is indeed the culprit and discuss alternative treatment options if necessary. Remember, communication is key when it comes to your health. Don't be afraid to ask your doctor or pharmacist about potential side effects of your medications, even seemingly insignificant ones like foamy urine. It's always better to be safe than sorry. And there you have it. We've covered a lot of ground today, from proteinuria and dehydration to UTIs and even the potential role of medications. Thanks for sticking with me through this deep dive into the fascinating and sometimes bubbly world of foamy urine. Remember, knowledge is power, and understanding your body's signals is the first step towards taking control of your health. If you found this video helpful, give it a big thumbs up and subscribe to the channel for more informative content on all things health and wellness. But most importantly, I want to hear from you. Have you ever experienced foamy urine? What steps did you take to address it? Share your experiences and questions in the comments below.